stood outside the Holm building, University of Sydney main campus. The ceiling of the refractory has collapsed and a number of people are injured. We understand a 21st birthday party was in progress at the time. There are a number of hazards at the scene. We don't yet know the stability of the building, but we can smell gas and smoke. There are up to 65 guests at the party, we understand. 20 or so have been able to walk away and have been treated on the lawn for minor injuries.
At the moment, we have some building concerns with structural issues. We've had partial collapse of the ceiling inside. My crews are inside now working with acro props to secure the ceiling.
We gave them no secrets about what was going to happen today, so on the first day of the course we said we're going to culminate in a mass casualty exercise. The purpose of the course is to give the student nurses the opportunity to work in the pre-hospital environment, and so the course is focused on what care we can provide before the patient gets to hospital.
All throughout the semester we've had different lectures about mass casualty simulations, how to triage patients in this sort of situation, and we've had different guest lecturers throughout the whole semester, which has been amazing.
I was a team leader, so that involved coordinating the care. It involved coordinating the staff that we had, trying to get resources to different places. There's people screaming, there's blood coming out of legs. It becomes very difficult to try and retrieve that information, especially when you're a leader. There's people who are asking you, what do I do now? And you have to know. That was one of the biggest challenges, was retrieving that information.
There's a lot more challenges to this than it would be, let's say, in a hospital. There's a lot more things they have to think about. Things like danger and scene control, you don't really have to think about as much in the hospital. Also, the resources that you use become really important.
The other thing about the simulation that is a little bit different for our event today is that it's interprofessional. So here we've got some medical students working with the nurses, we've got health science students, and all of these health professionals working together is the best simulation possible of everybody working together in real life, be that in a hospital or be that in a pre-out of hospital setting.
Today we learnt so many skills. Communication's a big one. We've been taught that and that's been reinforced throughout our whole degree, but today was sort of the day where you really need to communicate with other health professionals and of course the patients.
Today was about assessment, it was about planning, it was about nursing intervention. It was everything that we've learnt in this degree.
This is a day that we've been building up to for our whole semester for our subject, and by having this on our second last day of classes for the whole degree has really made me end my degree on a high.
Are we confident that this is the next generation of nurses? Can they cope with the demands ahead of them? Absolutely. This is one component of their training, first line interventions, but there's been multiple other components that make for a well-rounded health practitioner, a well-rounded registered nurse.